Time now, 7:54, and 10 TV is your back-to-school headquarters. A new school year does have a downside, and that is exposure to a lot of new germs that can make your child sick. Here to talk to us about how to keep our kids healthy is pediatrician Dr. Dan Heinmiller, or Dr. Dan, as your patients call you. Thanks for being with us this morning, Doctor. First, let's talk to parents about the difference between a cold virus and a flu virus.
Well, basically, a cold virus is the most common respiratory infection that kids get and why they seek care. Now, a flu virus is more serious. It starts with cold symptoms, but then it develops into high fever, horrible cough, terrible muscle aches, headache, and it's just much more severe.
A cold can have your child down for the count. What are some telltale signs to know the difference?
Well, a cold, you have a little bit of a cough and sore throat, but a cold is mainly nasal congestion and runny nose. Younger kids may have fever, but most older kids do not. Yeah, cold is just much less severe.
Okay, very good. Let's talk about strep throat, because you'll be making a lot of those diagnoses over the next months. And talk about why that is so common and how you treat it.
Well, strep throat is very common in the 5 to 15-year-old children, and of course viral sore throats are more common than strep, but strep throat is evidenced by kind of acute onset with sore throat and headache, a lot of times a stomach ache and fever. Now, when it's a viral sore throat, usually there's a big component of runny nose and cough. You don't necessarily need to come to the doctor if you've just got a little bit of a sore throat and you've got an obvious cold. But if you have those other symptoms that I mentioned, you should seek consultation.
And when you have a strep infection, is that when you require antibiotics?
That's correct.
Let's talk about that, because I think it confuses a lot of parents. They come into your office, their child's very sick, they want antibiotics. That is not necessarily the cure for all of these illnesses.
That's correct. In fact, the push has been in the last 10 or 15 years not to prescribe antibiotics for colds or flu, because all that does is ferrets out resistant bacteria. Really, the only reason you need antibiotics are for strep throat or if you have complications of a cold, which are otitis media or ear infections or sinusitis.
Okay, good to know. Let's talk about then when to keep your kids home and when they can actually go back to school. What's some good rule of thumb?
Well, the rules are mainly if a child has a fever greater than or equal to 100, they just should not be in school. And parents should wait until they've been without fever for 24 hours before allowing them to go to school. And then secondly, if a child just has a horrible frequent cough or they feel very badly, they're extremely tired, parents should not send those kids to school, despite the pressures of two-income families and such.
Right.
Thirdly, I would say that if a child is having vomiting or diarrhea, they should stay home.
And Dr. Heinmiller, who should be getting the flu shot? What ages?
Well, what we say anymore is we recommend universal flu shots. And so babies from 6 months and to adults until, any age. So 6 months to
infinity.
To infinity, right.
The flu shot is not going to give you the flu.
That's correct.
All right.
That's very much a myth.
All right. Dr. Dan Heinmiller, thanks so much for being with us this morning.
You're welcome, Jess.